Hello, my name is Alexandra Piedrahita. This is my Community Health Needs Assessment on East Baton Rouge Parish. I chose to do East Baton Rouge Parish because I've lived most of my life within the area, even though I just recently moved to another state. Currently, East Baton Rouge Parish has 4 major cities, and those cities are Baker, Baton Rouge, which is the Louisiana state capital, Central City, and Zachary. Here are some demographics of East Baton Rouge Parish. The parish houses a total of 448,467 residents, making up 9.8% of Louisiana's population. With Louisiana having 64 parishes, East Baton Rouge Parish is the 48th largest. The percentage of high school completion was 90.8% in the parish, and those that finished their bachelor's degree was 38.2%. Employment rate in East Baton Rouge Parish was calculated at 60.8%, and based on the United States Census report, the current median household income was $61,400, and 59% of people in the area own their homes. Although there is a high percentage of home ownership and employment, 18.5% of those in the area are living in poverty. In East Baton Rouge Parish, there are currently 12% of the population struggling with access to food and overall food insecurity. Also, the number of those without health insurance was noted to be 9% within the parish. East Baton Rouge Parish contains several healthcare systems. In the Baton Rouge area alone, there are 5 major hospitals. Our Lady of the Lake Regional Medical Center, which was the hospital that I worked at in my time living within the parish, Our Lady of the Lake Children's Hospital, Women's Hospital, Ochsner's Medical Center, and the Baton Rouge General. Currently, Our Lady of the Lake is holding as a Level 1 trauma center, and Our Lady of the Lake Children's Hospital currently holds as a Level 2 pediatric trauma center. In Zachary, the local hospital is Lane Regional Medical Center that aids in the care of the outer parts of the parish. Here you can see a few pictures of the different hospital systems within the area. The first picture is the sign to Women's Hospital. The second is Our Lady of the Lake Regional Medical Center. And the third is the Baton Rouge General. Access to education in East Baton Rouge Parish can be found in either public schooling or private schooling. Currently in the parish, there are 83 public schools ranging in elementary, middle, and high schools. Private schools in the area are also high, with there being 40 different schools ranging from elementary, middle, high school, and even K-12 institutions. There are also a plethora of universities within the area. Baton Rouge is the home of Louisiana State University, Southern University, Baton Rouge Community College, Franciscan Ministries of Our Lady of the Lake University, Baton Rouge General Medical Center School of Nursing and School of Radiologic Technology, as well as several technical training institutes. East Baton Rouge Parish is known for its plethora of activities. First, starting with historical sites. Residents or visitors can enjoy the USS Kidd Veterans Museum, which is an old U.S. Navy Fletcher-class destroyer ship, as well as Louisiana Veterans Museum that has displays of old veterans inside. Baton Rouge is home to Louisiana's state capitals, both old and new. Within the parish, Louisiana's Royal Life Museum sits to show visitors and locals the history of rural Louisiana in both the 18th and 19th centuries. Lastly, there are historic plantations that are notable to the area and culture of Louisiana. Their names are Santa Maria Plantation and Magnolia Mound. Here I have taken a few pictures of some of the historical sites in East Baton Rouge Parish. To the left, you have the USS Kidd Veterans Museum. In the middle, you have Louisiana's new state capitol. And on the far right, you have Louisiana's old state capitol, which is home for many museum tours in Louisiana history. Other things to do within the East Baton Rouge Parish are viewing museums like the Knock Knock Children's Museum or the local zoo. Many locals and visitors partake in different festivals like the Baton Rouge Blues Festival, where live music and Louisiana cuisine are out for all to enjoy, as well as Mardi Gras festivals. Aside from those events, many locals enjoy coming together for LSU sporting events, running the LSU lakes, or even exercising on the Mississippi River levees. Here I've included pictures of local places that many people partake in. The first one on the left being the parade grounds at LSU, where plenty of people either tailgate or come together and exercise or have community sporting events. The middle picture is Baton Rouge's Children's Knock Knock Museum, which is a great place for education, and many schools send their kids there for field trips. And lastly, on the right is a picture of the LSU lakes. Currently, the LSU lakes are being reconstructed due to environmental factors. However, the paths are open and the scenery around LSU's campus is beautiful. East Baton Rouge Parish has several community strengths. One notable strength is the access to medical resources. Data shows that 46% of people utilizing Medicare receive their annual flu shot. In addition to that, the ratio of providers to the residents in the area are far better than the national and state averages. Currently in East Baton Rouge Parish, for every 200 people, there is one mental health provider. And for primary care providers, there is one provider per every 1,150 people. Another great statistic is the percentage of people who live near a park or recreational facility, this being 96%, showing that there are great opportunities for exercise. Here I have put together a few key weaknesses within East Baton Rouge Parish. The two most concerning issues being the number of sexually transmitted diseases, especially the human immunodeficiency virus, better known as HIV, within the parish, and violence-related deaths in the area. The CDC released that in 2020, Louisiana was ranked 4th in the U.S. regarding HIV case rates, and 11th in overall estimated HIV cases. With that being said, Baton Rouge was ranked 7th among the metropolitan areas regarding HIV case rates. Currently in East Baton Rouge Parish, there are 1,088 residents diagnosed with HIV per 100,000 people, and 1,027 cases of newly diagnosed chlamydia per 100,000 people as well. East Baton Rouge Parish also has a notable crime problem that has resulted in 25 homicides per 100,000 people and 33 firearm fatalities per 100,000 people. This data is by far larger than the state and the national average. I gathered statistics on my demographics as well as my community strengths and weaknesses from census reports of the parish. I also utilized previous community health needs assessments from local hospitals that focused on STD prevalence and violence in the community, and later derived my goals and plans of action based on past techniques that they spoke about. The goals that I put in place for the East Baton Rouge Parish are: 1, to improve early detection and prevention of HIV and other sexually transmitted diseases in the area. The second one being improve the access to medical assistance for those affected by HIV and STDs in the area. And lastly is to improve education on the effects of violence in East Baton Rouge Parish schools. My objectives relating to first violence and education understanding is to improve education on the effects of violence and identifiable factors on community violence through the development of and implementation of an age-appropriate violence protection program that has a curriculum for ages K through 12 in school systems within the parish. This program will hopefully provide children the tools to identify key factors in reducing violent crimes and help them understand the negative effects caused by violence, thus ultimately stopping violence before it even starts. My objectives regarding HIV and STD prevalence and prevention are partnering with community health care workers to determine high prevalence areas of HIV and STDs within the parish and provide access to testing centers as well as contraceptive products to promote safe sex and lower the spread of disease, and also to increase the public interest of HIV and STD early detection through social media and advertisements throughout the parish and in high prevalence areas. In evaluating my efforts, I plan to first start with assessing the health behaviors of the residents within the parish. So regarding HIV and STD prevalence, first I would survey the residents in areas of prevalence on changes in health behaviors to promote safe sex, whether or not they decided to make any changes to their daily lifestyle, and then also assess the number of tested new cases relating to HIV and STDs compared to the time prior to my intervention efforts. This will allow me to see if there are any positive or negative trends in the community and potentially any areas that I can adjust to improve outcomes. As for the educational standpoint in violence, I plan to survey students in various age groups on their takeaways from the violence prevention program and assess the need for further educational understanding. These types of surveys will definitely be geared toward the developmental age of the child and ultimately help the program develop as time goes on. And here are all my references.